Good morning. I'm Sophie Hyndman. I'm Deputy Director of the Research Design Service South Central, and a very warm welcome to this event, which is all about supporting social care research in South Central and Wessex. And also a massive thank you to all of you for signing up today. Now, we originally planned to hold this event in May last year, but obviously had to postpone. And the focus was then to try and get practitioners and researchers together to start thinking about research areas and perhaps even kick-starting some collaborations in relation to social care research. But in rescheduling the event, we felt that those providing and delivering social care would very much have their hands full, and it might be unrealistic to expect many to come along given the circumstances. We therefore adjusted the agenda to be much more about how to support those wishing to get involved with social care research. However, I'm completely delighted to see that we do have providers, practitioners and users of social care services here today. So really a very special thank you to you for making the time to come in what are still very challenging times, I think, for everybody. I think it'll make a real difference to what we can achieve today, and we hope to at least get researchers, providers, practitioners and users to talk about social care research together and how we might move forward from here. I thought I'd better say just a few words about the National Institute for Health Research, just in case some of you are less familiar with it. Basically, it was established in 2006 following the report Best Research for Best Health. And its mission statement is to create a health research system in which the NHS supports outstanding individuals working in world-class facilities, conducting leading-edge research focused on the needs of patients and the public. That's quite a grandiose statement, but in fact, to give the NIHR their due, I think the amazing infrastructure that we've had has been wonderful and essential in the last 18 months, so hats off to them, really. Part of the mission is to fund, support and deliver high quality research that benefits the NHS, public health and social care. Now, if we look at the NHS priorities, it's primarily adult social care, but it very much operates at the interface between child and adult services, and indeed the interface between adult services and other contexts. And you'll see later on in the presentations, you'll get a much better idea of what the NIHR remit is. Just a word about the local National Institute for Health Research bodies who have contributed to this day. Firstly, the Oxford and Thames Valley and the Wessex Applied Research Collaboration. So that's two organisations. I'm not going to go into a lot of detail about what we all do, but do feel free to look us up on the internet. The Thames Valley and South Midlands and the Wessex Clinical Research Network. So that's again two organisations, and the Research Design Service South Central. Basically, one way or another, we're all involved in supporting research development and delivery in the South Central and Wessex areas. I also want to put in a word for the Research Design Service South West, because I know they're represented here today, because they cover parts of Wessex not covered by RDF South Central. I think basically we've been a bit subject to the vagaries of historical boundaries. The Research Design Service South Central covers a certain area, basically Oxfordshire, Bucks, Berks, and Hampshire and the Isle of Wight. Actually, if you look at NHS England, their South Central region extends to cover parts of Wiltshire and Somerset. And of course, the original Anglo-Saxon Wessex also includes Dorset. So basically, we're talking about two overlapping historical regions that are covered by these various organisations. The purpose of the day, well, firstly, is to find out more about current issues in social care. And you'll note that all the speakers will take on board what has happened to us in the last 18 months. So we will be talking a bit about the impact of COVID on everything. We also want to cover the funding that's available for the National Institute for Health Research for social care research. Importantly, we want to work together or start working together to support the development of social care research in South Central and Wessex regions. And I should say that these kinds of initiatives are being replicated throughout the whole of England. So, for example, other RDSs I know are involved in events such as this. And obviously, ultimately, it would be great for us all to connect to each other in terms of the social care research delivery. It's also an important opportunity to network, and I know it's very difficult and different when you're doing things online, but hopefully when you're working together in groups later on, you will have an opportunity to meet each other in a little more personal way, face-to-face way. I'm delighted that we've got such a great list of speakers with us today. Firstly, you're going to hear from Luke Kjolkagen, who's Head of Policy and Research at the British Association for Social Workers. And I think it's really important that we get the sort of social work perspective on social care research. We then have Sir Andrew Dilnott, who's going to be talking about issues in social care today. And many of you, of course, will know that Andrew Dilnott was the chairman of the Commission on the Funding of Care and Support in 2011. So he's really very well versed in the issues that face social care today. We then have two people from the National Institute for Health Research. Firstly, Martin Knapp, who will be talking about adult social care research, past, present and post-COVID future. And he's from the School for Social Care Research, which is a sort of a body within the NIHR that is promoting and funding social care research. And then we'll hear from Laura Mason, who's the Senior Programme Manager for the Research for Social Care scheme. Now, this is a very particular funding scheme that the National Institute for Health Research run. That's a sort of sister programme, I suppose, to the Research for Patient Benefit scheme that's been running for a long time. So she'll be talking about that scheme.